Welcome to the meeting. I think everybody should be able to hear and see us now who are waiting for the meeting to start. So thank you for joining us. My name is Brianna Titone. I'm State Representative in House District 27. And today we're going to be talking to some panelists here that are going to talk about mental health and well-being and doing helping you address your questions about how you can stay healthy and with your mind and body during this time that we are in the COVID crisis here. I'll just set up a little bit of things for you just to let you know. There's a Q&A panel if for those of you who are not on the phone. If you open up that Q&A panel, you can start asking questions. We have a good morning in there now, so it looks like some people already know how to do it. Thank you for that. We will be answering these questions live once we get the introductions and everything out of the way. So feel free to add questions as you come to you. Put those in there, and then we'll get to those when we get to that section. So I just wanted to tell you a little bit about what's going on for me. I've been working with some of the IT folks who are helping us develop ways for us to do our committee hearings with members that may not be able to come to the Capitol. So we're working out a system and some changes that we may have to make depending on what the situation is at the end when we finally go back. We're hoping that most people will be able to go to the Capitol and take part in the proceedings there, but there may be a few members that won't be, so we're trying to accommodate those folks who aren't able to do that. I've also been doing some informal Zoom meetings, so take a look at those, make sure that you can find those online, and please join me for those. We have one coming up with Congressman Perlmutter and a couple other people that's coming up next Saturday. And we're going to have another one coming up in the beginning of May. So just watch for the social media posts. And if you're not on my email list, get on my email list, briannaforcolorado.com. On the Get Involved page, sign up on there. And you'll get my updates. They come in on Friday afternoons. So you'll get all that information. I want to kick it over to my other legislative colleagues who will give you their little updates on what they've been up to. But feel free to reach out to my office or anyone else's office that you need information on. If you're not sure about something, we're here to help you get the information that you need. So I'll kick it over to Senator Zenzinger.
Thank you. My screen just all of a sudden froze, so I didn't know if you could hear me. So
nope, I can hear you. Yeah.
Well, welcome everybody. I'm State Senator Rachel Zenzinger. I represent Senate District 19, which is Arvada and Westminster in Jefferson County. And thank you for joining us today. A couple of things. I am a member of the Joint Budget Committee, and last week, I think, it's hard to remember because all the days are blending together, but last week we announced our timeline for returning back to the Capitol in order to start putting together the budget. We are planning on returning the week of May 4th to start reviewing our revenue scenarios and looking at our balancing options and any statutory changes that we need to make to go with the budget. As you all are probably aware, right now we are experiencing quite an economic downturn in the economy because of the stay-at-home order and the impact of the pandemic to our local revenues. This is nationwide, but particularly it's hitting our local economy and our state economy pretty hard. We are anticipating that the budget this year, we are going to be down about Oh gosh, we're estimating anywhere between 2.5 and $3 billion in the budget. So we have a lot of decision making in front of us. On Tuesday, May 12th, we're going to receive a mini revenue forecast. Typically, we do quarterly revenue forecasts, and we use the March forecast in order to balance the budget. This year, when we received our March forecast, it was about less than a week after the crisis was really starting to hit Colorado. So in those numbers in that revenue forecast, what we were told is that we were already down approximately $750 million from the January forecast, and that was before the stay-at-home order. So it's going to be interesting. We're not slated to receive our next revenue forecast until June, and that's going to be too late for us. You know, state law, constitutionally, we need to have a pass our balanced budget by June 30th. All of the county governments, the school districts, all of the budgets are due before then. So we're going to try and make decisions based on a smaller mini revenue forecast that we're going to receive from Legislative Council and from the Office of State Planning and Budgeting, so that we can make our final balanced budgeting decisions. That will be available to the public, so you can participate, you can listen in to that revenue forecast on Tuesday, May 12th, and just be looking to my Facebook or my newsletter for details and information on that. And then finally, our goal is to have the budget introduced the week of May 18th. We go back and forth between the House and the Senate. So this year, the budget will start in the House, and we hope to do that the week of May 18th. And then the budget would come to the Senate on the week of May 25th. And we're hoping to have the budget finalized at the end of that week so that everybody else, local governments, school districts and whatnot, can move forward with their own budgeting and know what's what. So it's going to be an interesting process to essentially redo the budget. Unfortunately, it was 98% completed before this crisis started. So we're kind of having to start over in a very compressed timeline. As far as events, I do host a weekly town hall on Wednesdays at 3 p.m. I do hope that you can join us for that. And again, just look for my newsletter or my Facebook for details. And if you need information, you're always welcome to send me an email at senatorrachelz@gmail.com. Thanks.
All right, Tracy, go ahead and give us your update.
Great, thank you. So as Rachel said, right now we are looking at going back May 18th or 19th. So there's a lot of questions about what happens to everything before we left on March 14th. And basically everything just kind of froze in place. So there's about 250 bills that are sitting out there, and they are frozen in place. They have not moved since March 14th. Right now, the chairs of committees are talking to all the sponsors of those bills, looking at a couple important questions. One is, does it have a fiscal note? As Rachel just said, any bill that has a fiscal note, it's just going to be a serious problem this year. But the second question is that the world has really changed, and we really are looking at two important themes. How are we dealing with COVID-19, and how are we going to deal with the economic recovery? So the question that we're asking around bills is, how does your bill deal with COVID-19, and how does your bill deal with economic recovery? So a lot of decisions will be made. We do have the gavel amendment, so all bills will need to be heard in committee. But you know, what happens to those bills afterwards will be a question. The question I often hear from people is, will there be a lot of new bills that are introduced? What I'm hearing is no, there will not be a lot of new bills that will be introduced, but there could be some bills that will be introduced that really help with those two themes that I just mentioned, around the pandemic and around the economic recovery. And then really looking at the governor's work and all of his executive orders. So as both Brianna and Rachel said, we really, while we are at home, We are not home on vacation, although I do tell people that yes, I am keeping up with my soap. That's the advantage, I think, of being able to work from home. However, I think we all are getting a lot of work done. We are in regular contact with the governor's office and with all the departments around what's happening, talking with our county commissioners, our different department heads here in the county, which we're honored to have here with us today. My office is also doing calling. And so if anybody is interested, we are calling seniors just to check in, and then also to see if they have deliveries that they need, whether that's grocery, pharmacy, errands. So if anybody is interested in volunteering to either make phone calls to folks in the district, I will tell you, some legislators, Brianna, I hope it's not you, are calling people that are seniors 65 and older. I'm not doing that, okay? Seniors is not 65 and older, let me just tell you. So we are calling folks and just checking in, making sure they're okay, because people are feeling pretty isolated now, and then also to see if they need help. So please call my office. My team, Lindsay, who I know is on the Zoom call, and the rest of my team is doing an exceptional job. And so if you are wanting to volunteer in calls or deliveries, please do let us know. I'm posting regularly on Tracy for Jeffco around a lot of the updates around what's happening, both with policy, both with the with the pandemic, but also with our economic situation. So I encourage people to join me on Tracy for Jeffco on Facebook. And then finally, the last thing I have is today at between 1:05 and probably about 1:20, everybody should be outside staring at the sky, because the Thunderbirds will be coming across the sky. Yes, do that again, Rachel. Can you make the noise? She's on mute. So the Thunderbirds are on their way to go over the Air Force Academy graduation. But as a thank you to all of our first responders, the Thunderbirds are starting in Greeley at 12:50, and then we'll be going to Boulder about 1:05, coming across Arvada and Golden, and then going down through Colorado Springs, and then finally Pueblo. So while most people are going outside at 8 o'clock at night, today we'll all be going out in the middle of the day, staring at the sky to wave at the Thunderbirds. So thank you all, everybody, for joining us. Really appreciate it.
All right. Well, thank you for the update. So we have some extra people here on our panel that are experts in the area of mental and physical health. And I want to introduce them and give them a chance to answer your questions. So at this point now, if you have any questions, this would be a good time to start putting some questions in the Q&A box. I also want to remind you that we're recording this, and we're going to be putting this on our websites and social media for you to check out at another time. So first off, I want to introduce Dr. Mark Johnson. He's the Executive Director of the Jefferson County Public Health. We also have Heather Trish. She's the Director of Culturally Relevant and Trauma-Informed Services at Jefferson Center for Mental Health. And then I'm also pleased to introduce Dr. April Alexander. She's a Clinical Assistant Professor of Psychology at the University of Denver. So let's go through there, and in the order I introduced you, give yourself a few minutes to introduce yourself and whatever else you want to mention about what's going on with this COVID thing, and whatever else you want to say.
Thank you very much, Representative Titone. I am Dr. Mark Johnson. I'm the Executive Director of Jefferson County Public Health and have been for the last 30 years. I was planning on retiring here next month or so, and that has been put on hold because of the COVID-19 issues. But hopefully we'll be able to retire soon. Actually, today I'm supposed to be riding bikes through the tulip fields of Netherlands, which is one of my wife's bucket dreams, but we'll have to put that on hold also. My training is I am a physician, and I took what is called a specialty in preventive medicine and public health. The preventive medicine side deals particularly with sort of lifestyle and behavior and those kinds of things that you can do to keep healthy. And spent 3 years working in that at a academic center in Southern California, and then decided I did not want to raise my children in Southern California. So looked to see if there was anything available in my wife and my home state of Colorado. And at the time there was not. So we ended up in Wyoming for a couple of years working with the state health department up there before this position became open here in Jefferson County. I figured I'd be here for about 5 years and then I would move on to either the state or the federal level. But every time something interesting came up, my wife and kids said, "We'll miss you, we're not moving." So I am still in Jefferson County, and it has been a wonderful career. The issues that all of us are facing right now are unprecedented. I think that word has almost lost its meaning because everything is so unprecedented these days. But it does raise special questions around the how do you deal with this from a physical point of view. I believe that we have, in working with the governor's office and the state health department, really done a fairly good job of trying to balance that in the stay-at-home order. That there were restrictions were not put on getting out and exercising. In fact, we were encouraged to get out and exercise to make sure we're taking care of ourselves as much as we can, instead of just hunkering down and watching our soaps in home. But to get out to exercise, but to also be very careful as far as how we do with social distancing. The balancing act is that we have overwhelmed our parks and open space areas to such a degree that social distancing has been very difficult. And so we have been trying to work with open space and our parks and rec districts to figure out the best way to deal with that. The best advice is, if you can at home, get out, walk around the neighborhood, find a park close where you can do some exercise. That's the best thing to cut down both on travel and on the overwhelming of the park system. And the other thing that is important is to also be careful in how you are taking care of the other side of your physical health. Are you eating well? Are you making sure that you're not drinking too much, or that you're doing other things that are detrimental to your health? Are you making sure that you're getting enough water to drink, and that you're doing those kinds of things that help to keep your body healthy? I don't like to separate the body from the mind, and I'm glad that we have some experts here to talk about both the mental and spiritual health sides of things. And I will, at this point, turn it over to Heather to talk a little bit more about the mental health side.
Thanks, Dr. Johnson. Thanks for having me here this morning. I am Heather Trish. I'm the Director of and Trauma-Informed Services. So that Titone is that I am a doctor, and with our diversified trauma-informed care, our bilingual clinic, our veteran and military family services team, as well as suicide prevention. I've been at Jefferson Center for 14 years. Remind folks that
Heather, can you hold on a second? Is anybody else experiencing some issues with the sound quality?
Yes, it's choppy on Heather's end.
Okay, so I just wanted to stop and acknowledge that we're having some transmission issues hearing you, Trish, or Heather. If you could maybe just briefly start over at the beginning, because I missed most of what you said.
That's not good. Can you hear me now?
Yes, thank you.
Excellent. Well, we will do a do-over. So let me explain who I am and what I do. Can still hear me? Center for Mental Health. Nope.
Nope.
Still having
Heather,
trouble.
yeah. Heather, how about we jump to Dr. April, and then we'll circle back to you. I don't know if there's an ability to move somewhere or.
I'm gonna hop off and hop back on and see if that helps, okay?
Great, thank you, Heather.
Hi everyone, I'm Dr. April Alexander. As was described a second ago, I'm an assistant clinical professor at the University of Denver. I'm housed in the Graduate School of Professional Psychology, which a lot of our work is dedicated to public service in the mental health field. So within our department, we have a master's in international disaster psychology, a master's in sports coaching, sports and performance psychology, and then the master's in forensic psychology program where I'm housed, as well as a doctoral program in clinical psychology. My own background and training is in clinical psychology with a focus on forensic psychology. I originally got into this field in working with victims of interpersonal violence, really just wanting a sense of what is the degree of interpersonal violence in our communities, how's it impacting our communities. And then I moved over a little bit into wanting to know more about the legal side. So that's where I found this field of forensic psychology, which simply means the intersection between psychology and the legal system. So in these last few years, I've worked with both victims and offenders of violence, really looking at violence prevention. And before that, a lot of my work kind of intersects with Dr. Johnson's work of really figuring out these social determinants of health. You know, what are the things that we need in order to have healthy physical health and mental health in our lives? So during this response to COVID, I'm most concerned about just access to care, especially in marginalized communities or communities who have been negatively impacted by COVID. What I'm seeing right now is, one, we are seeing an increase in crisis calls for individuals who are experiencing interpersonal violence or child abuse. So just making sure that we're providing resources and thinking about those families. Also just thinking about access to other healthcare services right now. What do we do in terms of supplying mental health care to people in communities? Luckily, within the Graduate School of Professional Psychology, we have the professional psychology clinic housed in our building. And what that clinic is, it's a training clinic for our PhD students in clinical psychology, and they are supervised by licensed psychologists throughout the community. And so we provide services on a sliding scale. We accept Medicaid. We also provide some pro bono services to people in the community. And with this crisis that's currently going on with COVID, we quickly had to transform a lot of our services to telehealth. That this was something we had been considering for a long time in order to better serve our community in the Denver metro area, as well as rural populations out there. But with COVID, we had to quickly react and respond to community needs. So we have recently transferred our clinics on, again, telehealth. Again, we have our general clinic, which is the PPC. We also have a trauma and disaster recovery clinic for individuals who have histories of trauma or are currently experiencing re-trauma during this COVID crisis, because it is a trauma. We all have had our lives changed and impacted by it, and so we should recognize that as a disruption in our lives. And then we also have the STERM clinic, which is dedicated to serving active duty military members, their families, and veterans of the military. So again, we're trying to provide services to people in the community who need them the most. And then just crossing over with a lot of our community outreach work. We're also hosting Monday through Friday virtual dance parties for children. So you can check out our website, and every morning at 8:30, we're hosting a virtual dance party Monday through Friday. It's been really exciting to just think of ways that we can connect with each other. Psychologists have said we don't want to label this social distancing, we want to label it physical distancing. That we want you to be socially connected to your loved ones, to your neighbors, to your friends. And so our virtual dance party is one way to do that, and it's been really successful in these last few weeks. Myself and my dog will be hosting a special dog themed one in 2 weeks, so please come and join us through that. And that's kind of our core message from myself and my colleagues, is that during this time, we hope that you can find some degree of normalcy for yourselves in order to protect, again, your physical and mental health. As Dr. Johnson said earlier, I've heard stories of people who haven't gone outside in these last few weeks. And they've talked about how hurtful that has been to, again, both their physical and mental health. So figuring out ways, if you can in your community, if it is a safe environment, to get outside, to create a sense of normalcy, to make sure you're checking in on yourself and your friends. Also, with a lot of people who are doing telework or who are teaching their kids at home, trying to set firm boundaries for yourself. That when we're doing telework and when we're teaching our children in our homes, those boundaries get blurred. That I don't know when the workday starts and ends. I've heard people working much longer into the night. And so just considering those things when we're talking about protecting yourself during this time is what I hope that you can gain from this. Again, we'll try to put Heather back on, and I'll take questions if you have anything else that we'd like to touch upon.
Okay, can we try this again? Does that sound any better? Okay, I have my phone just in case. So it's sitting here, I'm doubly connected. So thanks for having me. I'm Heather Trish, I'm with Jefferson Center for Mental Health. I'm a clinical director there, and I work with the Trauma Services Program, Suicide Prevention, Veteran and Military Families Services, our bilingual clinic, our Spanish bilingual clinic, cultural relevancy, trauma-informed services, zero suicide, as well as suicide prevention. I've been at Jefferson Center for 14 years, and I appreciate the opportunity to be on here today and talk a little bit about mental health. We want to make sure that folks know that we are here for the community in Jefferson, Clear Creek, and Gilpin counties. We serve actually the wider metro area. We accept a variety of different payer sources. We have substance abuse and withdrawal management and co-occurring services. We have wellness services. We as DU, as most mental health providers, have transitioned to providing telehealth, video and phone mental health provision services just as a result of COVID. So if folks are feeling the impact, as most of us are as providers, as community members, as well as those who are in the community with pre-existing mental health conditions, we are open for business and we are happy to help support. We have provided community webinars and forums. We've participated in these virtual town halls. We're really trying to get the word out about mental health and making sure people are taking care of themselves in this time. It's an easy access to connect with Jefferson Center. That's 303-425-0300, or going to jcmh.org and seeing what services we are offering. But just really happy to be here and happy to answer some community member questions about mental health and wellness.
All right, thank you. We don't currently have any questions right now, so any of the attendees want to ask some questions and get those in the queue, we can get started answering your specific questions. But in lieu of that,
Representative Titone, a few people asked about the virtual dance parties.
Yeah.
If you're on Facebook, you can look up the Graduate School of Professional Psychology and see our link. Or you could go to www.du.edu/GSPP, and you can find out more information about our clinic and our virtual dance parties.
All right, well, good, thank you for that. And we can try to get that information out on our websites and stuff too, and Facebook to promote that for you. Looks like we have a couple questions coming in through the Q&A box. Let's just start out with one here: anxiety versus anxious. What are the differences and the strategies there? Who wants to take that one?
I can take that one if you can still hear me. You know, there are two different things going on here, right? There's the very understandable anxiety that's occurring for most of us as we kind of navigate through this different world that we're living in right now, which is often physically distant, hopefully not socially distant, but physically distant, kind of in homes, dealing with different environments, high expectations if you are employed, uneasiness if you have perhaps just lost your job or are not employed, just a variety of different stressors going on. So there's kind of this normal sense of stress and anxiety that can exist in a in a large scale situation like we're going through right now. And then when you're talking about clinical anxiety, that's a clinical diagnosis, and you have to meet a diagnostic criteria, right? So some people are experiencing one, some people are experiencing both. And for those people who are experiencing the kind of more pressed upon anxiety, these are times that you will notice perhaps your anxiety symptoms worsening, and that would be very understandable. Any kind of existing or current stressor that presses on a pre-existing mental health condition, whether it's anxiety, depression, PTSD, whatever your diagnosis is, those stressors press on the symptoms and they can make them worse. So to know that you're not necessarily doing anything wrong or missing anything, but that's a normal process that can happen with mental health symptoms. So what can you do? Some of the recommendations for stress and anxiety and clinical anxiety are kind of the same. You want to make sure that you are taking things bit by bit, step by step, chunking things down, breaking them into smaller pieces so it doesn't feel so overwhelming. Creating a routine is incredibly important right now. It doesn't have to be rigid, but without the constraints of a commute or a work start time or things like that, or even children who are going to school on a daily basis, that routine has been broken. And so it's important to create some sort of a routine within your home at this point, and that will help kind of decrease the anxiety a bit. Make sure to socially connect. You are physically distant, but we need to stay socially connected. So classes that are happening through the rec centers or the libraries or mental health centers or the schools, wonderful example of a way to socially connect through from your home. Choose your media exposure, limit that news, and choose your sources for news very carefully. That's really something that is important because people can take that information two ways. Some people, a lot of information in detail makes them feel calm and in control, and for another person that can do the exact opposite and really skyrocket their anxiety. So choose that media exposure and notice what it does to you, and if it's not working well, switch that media exposure. Exercising, meditating, breathing, connecting to any sense of a higher purpose, whatever that looks like for you, those are all very important things. Try to regulate your sleep. I know that can be difficult. I am someone who's going through that right now, just with the stress of what's going on in our world right now. It's been impacting my sleep. Dr. Johnson talked about the basics, like eating healthy. You might consider what you can create, how you can contribute. People feel empowered when they give back in some way, and there are a variety of different opportunities to do that. So those are just some ideas. I know it's a long list and it's very basic, but you might consider how those things look for you in your life and in your world right now.
All right, yeah, that's great advice. Anyone want to add anything to that before we go on to the next question? No? All right, I think you said it all. Senator Zenzinger, you want to ask one of the next questions?
Yeah, so one of the questions is, it sounds like there is a shortage of mental health providers, and what are we doing to address that?
All right, who would like to answer that question? Anyone?
I would just say to that, that is not something I have heard. I don't know if that's kind of something that's been shared in the community. That is certainly not true for Jefferson Center for Mental Health. And quite frankly, other providers I've seen, they are open for business. How they're providing that mental health support is very different. DU is still open, we're still open. I have not heard of anyone who's really closed down, but how those services are being delivered is a little bit different. But we're absolutely here for you. And I encourage anyone who needs that mental health support to connect and find that mental health support, because that can be really important and really beneficial right now.
Yeah, I think some of the concern is people don't know where to get access to these services. So I think that is sometimes more the issue. Where do I go? I believe a lot of our state representatives, including Representative Titone, have posted some resources about hotlines you can call to figure out where these sources are in your communities. So maybe again, some of our legislators can get that reposted so we can talk about ways in which people can get help, because there are providers all over. And again, a lot of them have transformed into telehealth services. So we're out here, we're willing. And so just figuring out what you need and where you can get it is probably the big issue in our community.
Yep, and we will keep reposting those resources to make sure people have access to those. Representative Kraft Tharp, do you want to ask one of the next questions, please?
He's on mute.
You have to unmute yourself first. There you go.
Yeah, I know that. No, what, you know, I can't read the question, so no, I don't want to. So let me make up a question. So, Mark, could you talk a little bit about the prevalence in Jefferson County? You know, have we reached the peak? Are we downward? What's the prognosis? What's the future look like for us?
I wish I had the answers to all of those questions, Representative, but there are some signs that things are beginning to level off. We get a dashboard of how things are going around the Denver metro area, showing the different counties, and I'm happy to say that our growth rate of new cases is flatter than Denver and Arapahoe counties. We're a bit more than some of the other counties, but it does appear to be leveling off. We did some modeling early, and as everyone knows by now, looking at models, all models are imperfect and some of them are useful. But the modeling that we have looked at, it appeared that we would have the peak in our caseload in Jefferson County somewhere between April 17 and April 23. So we're right in that area now, looking at are we going to start to see a decrease in those cases? Happily, we have not had this surge that had been a huge worry at the beginning as far as hospitalizations and the need for ventilators, so that in our hospitals that does appear to be leveling off, and that the ventilator use is actually beginning to go down across the state. So I think that we are probably somewhere close to the peak in new cases. That doesn't mean that we're not seeing new cases. And as you probably heard from both the president's plan for reopening, as well as most of what we've been talking about here in Colorado, before we reopen, we would like to see a decreasing number of cases for at least 2 weeks. That 2 weeks is the incubation period for this virus, or at least the average incubation period for this virus. And so we would like to see a decreasing number of cases for at least 2 weeks before we start really opening up. But I think we're getting close to beginning to see that curve and the peak start going down.
All right. Great. Thank you for that update. I think that people have been doing the things that they're going to help reduce the spread. So I think it's working well. So we just got to keep doing that until we make sure that the hospitals are not overwhelmed. Senator Zunziger, you want to go to the next questions, please?
Yeah, so this one came to us from Lori Dranka. Hello, Lori. She says, I feel a sense of reassurance by informing myself through gathering information through webinars and some television and some news reports and shows that give a balanced picture of what's going on out there. What's your recommendation for teenagers and children as far as limiting gathering information? In particular, they have a 10 and a 14-year-old.
think Heather covered some of this a bit earlier is one, we do want to be worried about our screen time and social media time, that there is a lot of frightening information that can be coming out and flooding to us as adults as well as our children. We do want to provide them with information. Children are often lost and confused about what's going on at this time. So being transparent to them in a way that's kind of developmentally appropriate. You know your children better than I do. So finding ways that you can talk to them about what is it that we know, and being transparent about there are things that we don't know. For instance, I don't know if we're going back to school in the fall. So just talking to them about that and creating kind of a sense of transparency while validating kind of their feelings, while assessing their feelings. And then also, again, instilling hope in our kids. That there's still a lot of great things that are hopefully happening within the household. They're having more time with their parents. They're still having a lot of support from teachers throughout the community from what I've seen. So, you know, instilling that hope within them, I think is really important. Another issue that's come up for young folks is just missing milestones right now. That kids can't go to birthday parties, we're missing prom, we might be missing graduation. So again, thinking about creative ways in which we can still celebrate those milestones within the household. So a few friends, we've had online virtual birthday parties for their kids to still bring in that family spirit, those friends, their community involved. So really recognizing that those milestones are losses. So do reflect on that, that those are losses. But think of, again, ways in which we can still celebrate in this really difficult time with your kids. The American Psychological Association has a list of a bunch of different resources for kids. There have been a few books that have already come out on kids and COVID. So if you go to apa.org, you'll see a lot of lists of resources about how to talk to your kids about some of this, some more details on how to support parents during this time. So please check out the APA website.
My kids attended the virtual prom last night with John Krasinski.
Nice. Yeah, that's great. You know, there's like a new reality we're all sort of coping with and creating new ways to do the things we normally would do in person, and you know, just keep coming up with those new ideas. I think that's important. I'll ask the next question from Lindsay Rasmussen. She says, some of my friends have been very difficult to deal with right now, but I know it's because they're struggling with everything going on. How do we approach those people right now and attempt to help? Looks like Heather wants to answer, or April, either one.
You know, approaching this with a sense of compassion and empathy. My kind of phrase right now is we're all in this together, that we all have good days and bad days, and that we all are under kind of distress at this time. Obviously, all of us have different kind of levels of distress. You know, I see another question about loss of job, loss of employment. So just really being compassionate and empathetic towards our friends during this time is important. A lot of our friends don't know how to seek out help sometimes because there's a lot of stigma around seeking help and seeking support. So just making sure that we're checking in on our friends, keeping connected, reaching out, being transparent about when each other is struggling and modeling that for each other. Because again, we're all in this together and we all need to be together as a community to help each other during this difficult time.
All right. I think that was a good answer. Senator Zenzinger, do you want to ask the next one?
Yeah, so this one has to do with the libraries for Dr. Johnson. The Jeffco Public Libraries have been a lifesaver for residents on a social and educational level. Is there any discussion of when they may reopen, even with physical distancing practiced?
Thank you, Senator, and that's an excellent question. It really deals with the opening of society as a whole. And as I mentioned a little earlier, there are some trigger points or some areas that we would like to see in place before things begin to open. We would like to be able to have a good testing program in place so that we can actually find where hotspots are, a good tracing program so that we can trace contacts to those who test positive. We want to continue to make sure that the hospitals are able to treat all of the new cases that we get. And then I mentioned that 14-day period with a downward turn in cases. But once that happens, it appears that what we're going to be doing is a tiered or a phased approach to opening up. And we're going to be trying to open up retail and places like the library where we can continue to have that physical distancing, where people can be able to buy and to go to places like libraries as long as there is a good distance from each other. I'm guessing that we will probably still be asking folks to wear masks while they are in public places, because it's not always possible to keep that physical distance complete while you are doing those kinds of things. But I do think that the library will be one of those places that will open up in that first phase, where we begin to figure out how people can move through the libraries in a way that still keeps that physical distancing and keeping those masks. I've noticed that in some of the grocery stores, they have made aisles one way. We may be able to do that in the libraries so that people are not banging into each other or coming into contact. So I do think that that's one of the things that will probably be in the first wave of those organizations and entities that we open up.
All right, great. Yeah, thanks. These are great questions. I wouldn't have even thought about the library in that sense. Here's another question from Kathy Blake. She says, how do people pay for the services, especially if they don't have a job? People may have anxiety about being unable to access services due to finances.
That's a great question, and I'm so glad that it was asked specifically. Again, I'm with Jefferson Center, so my answers often come from that place, but I know all you have to do is call our main number, 303-425-0300, and the person you speak to helps sort out the information that you have, right? So do you have insurance? Do you not have insurance? Are you self-pay? Do you need some help paying for your services? There's such a span of the way that we can pay for those services, and it's individual, right? But if you are out of a job and you perhaps now qualify for Medicaid, that's an option that we can walk through with you. If you don't qualify for Medicaid but are still having a challenging time paying for services, there's sliding fee scales available. There are so many ways to access the mental health support that you may need. Really encourage folks to reach out. And I know this is being recorded, and I know I'm speaking mostly from Jefferson Center from mental health perspective, but I also just kind of want to throw in there, for those folks who are in crisis, mental health crisis, suicide crisis, in a really kind of difficult place mental health wise, no matter where you are in the state of Colorado, you can always call the Colorado Crisis Line, and that's 1-844-493-8255. And that's a great resource just to connect to 24/7. And the folks that answer that line can connect you to whatever mental health service may be closest to you or most appropriate for your situation and your needs. So I do want to just share that as well, because that's another great mental health resource for those throughout the entire state of Colorado.
Yeah, great. Yeah, there are a lot of resources. Sometimes they are hard to find. So we will do our best to make sure that we are reminding people about those resources as they come up. Senator Zunziger, you want to take the next question? Or Tracy, can you read them now? Because you weren't able to before.
I'm still here. I'm still here.
Yeah, I know you weren't able to read them, so I wasn't sure if you wanted to do it. So
Harriet Hall has joined us, and she is the previous CEO of the Jefferson Center for Mental Health, and we're very honored that she has joined us. But she's got a really good question around what are we doing to, for our first responders, our healthcare workers, our mental health care workers. What are we doing to support them? Anybody that wants to answer that question?
Harriet, this is Heather. Hello. Harriet is my former boss's boss. Good to see you on the virtual town hall. I'll say a piece of this. I'm sure others have things to add as well. I will say Jefferson Center for Mental Health has been providing and recording webinars, and we just did one this week on Thursday morning that was recorded about trauma, vicarious trauma, the impact on these essential workers. So that's available on the jcmh.org website. So that's one resource, but we continue to offer mental health services to anyone really being impacted by this, essential worker or not.
I would just add that in some ways we have really let these people down as a society, that we have not had in place the kind of testing availability for them to quickly get them back to work, or to let them know whether they are safe to be in the positions where they are. That, I think, is a huge national embarrassment that we have faced, and that we're going to have to figure out what we're going to do to make sure that this never happens again. The other thing that I think we have not been as good about as we could have been is making sure that they had the personal protective equipment that they needed. Although we have had huge caches of stores here in the state, and we have gotten at least 3 shipments from the Strategic National Stockpile of protective equipment, we have not been able to keep up with the need. The anticipation was not that everybody was going to need to have this protective equipment, and that they were going to have to be changing it several times a day. And so those are 2 areas that I think have actually increased the anxiety for our first responders and our healthcare workers and our law enforcement agents. And I believe that is an area that is going to be a real black mark against our country here as we move forward.
Yeah, indeed. Senator Zenzinger, you want to pick up the next question, please?
Sure, and I'll just comment too that there's a real deep psychological impact to some of these frontline workers, in particular people who are working in nursing homes. We know how dangerous this virus can be in a nursing home or a long-term care facility, and just the weight of worry about that virus entering into that facility, and especially given the high mortality rate among the elderly, it's like every day, going into a situation where you have that weight on your shoulders is definitely taxing. So it's good that we're being mindful about the mental health of these frontline workers, because they're under a lot of stress. The next question comes to us from Karen Tonso, and it says the peak in caseload versus peak in hospitals versus peak in deaths. What are the implications for the differences? Maybe Dr. Johnson, you could start us off.
Yeah, that's an excellent question, and thank you, Senator. That's a difficult question also. If you look at the averages, the average person gets the disease. If they become positive, they get the disease, and if they do end up needing to be hospitalized, it's usually between 5 days to a week before they get sick enough that they need to be hospitalized. And then it can last in the hospital between another 7 days to some are actually up in the 20s as far as the length of stay, the days that are needed. So the first would be the peak of cases would come, and then about a week later, you'd begin to see the peak in hospitalization. And then somewhere around 7 to 10 days after that is where the sort of the split in the decision or the natural course of the disease, whether you begin to get better or whether you get worse and die. So there are 3 different peaks, and they're about a week apart and then about a week or 2 apart for looking at the mortality. What we're hoping to be able to do is to watch the cases, the numbers of positives going down. That's the peak, the number we're really looking at, more than the peak in hospitalizations or the peak in mortality. Once we begin to see that going down, then there's that 14-day incubation period that if it's going down, we should begin to see decreases in hospitalization as well as decreases in deaths over the next 14 days or so.
All right. Yeah. Thank you for that. answer for the question. Representative Kraftharp, do you want to take now the next ones?
Sure. So we have about 6 minutes left, and one of the things that we really have not touched on is around spirituality. So we've done a great job talking about the mental health aspects, great job talking about the physical aspects. So, as experts, could you also talk about the spirituality aspect of this?
Yeah, I think that's so important to touch upon during this time. Another loss that a lot of people have experienced are their religious institutions, their churches, their synagogues at this time. Again, many have gone online, but some don't have the capabilities of doing that. And again, I think it's about bringing community together. So figuring out ways that we can provide support to folks in their spirituality and their religion at this time. Also, again, I think the big question I keep getting is how do we instill hope? And that's a big part of religion and spirituality. And so again, just reflecting on why we have these stay-at-home orders. It's about protecting ourselves and protecting our neighbors, and having that sense of agency in this time of how do we do that and how do we get back to a sense of normalcy. I think all of our teachings from, again, various religions are really protective at this time and kind of thinking about this crisis, that we will overcome this. It's just a matter of time and a matter of kind of how we're abiding by, again, these physical distancing policies. And then I'm hoping that this invokes a sense of community, that again, we have to rely on each other in order to go forward. We have to rely on each other for, again, a lot of the things that Dr. Johnson was talking about earlier, for just each other's care. I see another question from Barb Stevens in there, which, yes, all of the work that I do on a clinical level and on a research level is about all these social determinants of health. Dr. Johnson just said a second ago, we failed our communities, that we didn't have a lot of these safety nets in order to protect us during this time. And I'm hoping that a factor of resilience that we will get over this time is community, and then coming together to figure out solutions so this never happens again, just like Dr. Johnson said, that again, we can help each other with insurance. We can help provide services to people. Poverty can be something that we can easily solve. But we haven't come together as a community to do that. And now that we've had this crisis and that has instilled this resilience and this sense of community together and this sense of brother and sisterhood together, I hope that all kind of ties into our religious teachings and moves us forward into overcoming this crisis.
Yeah, thank you for that. We have maybe just enough time for one question more, and then we're going to wrap up and just let you know about some of the other things that the three of us are up to. So the question is from Dave DeMont. He says, what about talking to our kids about reentry when things open back up? Any thoughtful tactics on that front?
I think depends on the age and what that conversation may look like. Knowing your kid is pretty important, what they can handle, what they cannot, and making sure you have an understanding of what's appropriate for what developmental stage, right? So you're not going to overwhelm a 3-year-old with details of COVID. They don't understand, right? You talk about maybe you may be able to see your friends next week as we kind of get back to preschool, something like that. But it's going to look different for different kids. I think the important things are to be open and honest about their concerns and have that open dialogue about what they are excited about, what they're fearful about, and what they're looking forward to, what they're nervous about, but really just addressing those openly and honestly. Kids are smart, they're quick, and they know when you're not telling the truth. So figure out a way to share information in a way that they can hear and they can handle. And that's going to be different for a 3-year-old, for a 7-year-old, for a 14-year-old, and an 18-year-old.
I would just add a couple things there, Representative, and that is, I think it's important for them to know that this is not going to go back all at once, and it's not going to go back completely the way it was before, that there will be differences. Even as they go back to preschool, there will be more physical distancing rules and regulations, that things things will be different in society, and it's not going to happen all at once, so that they're prepared for that.
And it can change. We all know this day to day, right? We plan for one thing, and then that changes when we've got to problem solve and do it slightly differently. So sharing that it can change as well.
And relatedly, is think about all those back to basics parenting skills that you've done before. So talking, having conversations about hygiene again, having conversations about boundaries, because again, our boundaries are still going to have to remain in intact with the physical distancing as we go back to school. So having conversations about them, like let's have hula hoop distance when we're going back to school and with friends and things like that. So going to those back to basics kind of conversations to give them a kind of sense of agency too in their own kind of care as we're kind of transitioning back.
All right. Well, that's about all the time we have for questions now. I'm just going to give Representative Kraft-Tharp and Senator Zenzinger and myself just a second to tell you all about what we're up to next. And then we're going to respect your time and sign this off. So Representative Kraft-Tharp, you want to go first?
Sure. So as I mentioned earlier, we are calling and doing check-ins with folks in the district and doing deliveries. So if you want to be part of our call-in team, you want to be part of our delivery team, please contact us and let us know. I want to say a special thank you to my staff, Lindsay and Marshall and Pedro, who have been really organizing it. And we've had a team of about 30, 35, 40 volunteers that have been working on this the last couple weeks. So really want to say thank you to all those folks. And then remind people, Tracy for Jeffco on Facebook is where we are posting pretty regularly around the updates around what's happening. So see you at 105. See everybody outside staring at the sky.
All right, Senator Zenzinger, go ahead.
Oh, thanks. I just want to say thank you to our guests. That was great information and I really appreciate it. We're doing weekly town halls every Wednesday at 3 p.m. and we record those, and I list the recordings in my newsletter. I traditionally do a weekly newsletter, but during the COVID crisis, I'm doing a midweek edition as well. So if you are not on the newsletter list, just send me an email, senatorrachelz@gmail.com. And thank you everybody for being with us today. We really appreciate it.
Yeah. All right. Thank you. And then I also want to thank our guests for spending your time with us today, traveling all this way through the wires to be with us. I have a virtual town hall coming up at 11 o'clock on April 25th, and that's going to be with Congressman Perlmutter. So tune in for that. Bring your questions. We're going to get a couple more guests in there as well. So we'll try to cover a specific topic depending on who's available. And we'll let you know more about that on BriannaForColorado.com, Brianna for Colorado on Facebook, Twitter, Instagram, all that good stuff. So that's where you'll get the most up-to-date information from me. And if you don't see something you need, just feel free to reach any of us and we will give you that information, and sign up for our newsletters, very informative. And thank you to my aide, Michelle, for doing all the behind the scenes stuff that's been really important to getting that information out to so many people. So thank you again for spending some time with us on Saturday. We'll be back here again on the web or in person, depending on how things pan out. If you're good about staying at home, maybe sooner. I don't know. We'll have to see. But thank you for joining us today. We appreciate you, and stay safe out there.